Welcome to the new member orientation for Child Health Plan Plus by Denver Health Medical Plan, also referred to as CHP Plus. Your health is important to us, and we are happy to have you as a member. The goal of this video is to provide you with a good understanding of the services and benefits that are available to you through your Child Health Plan Plus health plan. You'll need your Denver Health Medical Plan CHP Plus member ID card to get health care for your child. During your child's period of coverage with CHP Plus, we ask that you have this card with you at all times. Since this is the card you will need to use every time your child sees a provider, accesses a pharmacy, or anytime they receive medical services. Your CHP Plus member ID card looks like this. As a new member, we want you to know that you can receive care at any of the Denver Health Neighborhood Family Health Centers. In addition, children have access to school-based clinics located in Denver Public Schools. You can find a map of clinic locations with directions on our website at denverhealthmedicalplan.org. As a CHP Plus member, you have access to all Denver Health locations. All of your provider visits are at no cost to you, including annual checkups and all primary and specialty care. Eye exams and eyeglasses are at no cost to you. Please check the cost limitations. Immunizations and vaccines are at no cost to you. Urgent and emergency care is at no cost to you. Hospital care is at no cost to you. Prescription medicines are at no cost to you, and even some over-the-counter medications are available to you at Denver Health pharmacies at no cost, if they are prescribed by your Denver Health provider.
It is important to know you must receive all of your routine care from Denver Health providers. As a new member, your first step will be to establish care within the Denver Health network. This means that you will need to schedule an appointment with a primary care provider that will now be your primary care provider. You will normally see this provider for checkups and vaccinations, as well as if you are feeling sick and need to see a provider. You can be seen at any Denver Health primary care clinic. You can also go to a different clinic if your primary care provider is not available and you want to be seen more quickly. Most specialty visits and follow-up appointments will require a referral from your primary care provider. However, a few services do not require referrals. Generally speaking, most medical care starts with your primary care physician, also known as your PCP. If you need to see a specialist, your PCP will refer you, usually within the Denver Health Network. To schedule an appointment, please call our appointment center. If you need to cancel an appointment, please call the appointment center to do so. The Denver Health Nurse Line is available to you 24 hours a day, 7 days a week. Our Nurse Line nurses can help you by answering medical questions and giving you advice on appropriate care. Our Nurse Line nurses can also assist you with obtaining prescriptions for certain conditions, such as influenza, conjunctivitis, urinary tract infections, and more. In addition, they can help you with scheduling follow-up care with your provider for the conditions you are calling about. The Denver Health Nurse Line is a free service.
As we mentioned, your coverage benefits include emergency services and urgent care. You can visit any urgent care center that is convenient for you. In fact, you're covered at any urgent care clinic in the U.S. If you need emergency care, go to the nearest hospital or call 911. Your plan will cover you at any emergency facility anywhere in the U.S. Sometimes it's hard to tell if you really need the emergency department, It's important to know that urgent care centers and emergency departments are for services that cannot wait for a medical appointment. All routine care such as vaccinations and regular checkups take place in the doctor's office with your primary care provider. If you have an ear or sinus infection, need stitches, have a fever or flu, and can't get in to see your provider, an urgent care center is often the right choice. If the injury or illness is life-threatening, call 911 or go to the nearest emergency department.
If you have questions about your healthcare benefits or need help understanding how to get care, our Member Services Department is here to help. Member Services can help with benefit questions, eligibility questions or issues, billing issues. The Member Services hours of operation are 8 a.m. to 5 p.m. Monday through Friday. Our Member Services phone number is located on the back of your health plan ID card.
If your provider prescribes medication, they will send your prescriptions directly to your pharmacy. After that time, you have a limited number of days to pick up your prescriptions. You may select from a number of pharmacy locations, and you will need to let your provider know the pharmacy you prefer. Once you have an established prescription, you can refill your medications by phone using the phone number on your prescription bottle. If you fill your prescriptions at a Denver Health pharmacy, you can also use this link on our website, which directs to the webpage to sign up for MyChart. You have the option of obtaining a 90-day supply of most maintenance prescription medicines. If you take a prescription medication on a daily basis for an ongoing medical condition, speak with your doctor about switching to a 90-day supply. Prescriptions must be written by a Denver Health provider to be filled at a Denver Health pharmacy. You can also have your 90-day supply prescriptions sent to your home by mail using the Denver Health Pharmacy by Mail program. Visit our website or call the Health Plan Pharmacy Department for more information. If you have any questions about your pharmacy benefits, we invite you to call the Health Plan Pharmacy Department. Health plan pharmacists, nurses, and pharmacy technicians can help you understand your pharmacy benefits, as well as answer formulary or drug list questions, such as what medications your plan will pay for. They can also answer questions about the medicines themselves, such as medication side effects, drug interactions, how and when to take the medicines as directed, what the medications are used to treat, and what medicines should or should not be taken together. If a prior authorization is required, the Health Plan Pharmacy Department can assist you with that process. The Health Plan Pharmacy Department telephone number is 303-602-2070. This number can also be found on the back of your member ID card.
Please remember to always notify if you have a change of address or phone number. This will allow you to continue receiving important updates and information about your coverage and your plan.
Denver Health Medical Plan, Inc. and Denver Health Medicaid Choice respect the privacy of your health information and will protect your information in a responsible manner. We are required by law to maintain the privacy of your health information. We must get your written permission to use or share your health information. If you give permission, your health information will only be used in the manner you authorize. However, federal and state law allows us to use or share health information without your permission for the purpose of treatment, payment, and healthcare operations. The following are a couple of examples of some of the ways we may use or share information about you. To pay for your health services and make sure your medical bills sent to us for payment are handled the right way. To help doctors or hospitals provide medical care and coordination of care to you. Denver Health Medical Plan, Inc. and Denver Health Medicaid Choice has a fraud, waste, and abuse program. If you believe that someone else is using your health insurance information or your identity to get medical services, please contact our compliance officer immediately. You can also reach us by email at compliancedhmp@dhha.org.
We want to provide you with the best service possible. If you're ever unhappy with your experience at Denver Health or with your health plan, we want to help make it right. If you're ever unhappy about an experience you've had, you should file a grievance. For example, if you're unhappy with the quality of care or service you receive, or the way you've been treated as a member or as a patient, a grievance may be filed. If you have a grievance, please call or write to let us know.
This concludes your new member orientation. You may want to pause the video now to write down important phone numbers or look for them in your new member packet. Thank you for being a member of Child Health Plan Plus by Denver Health Medical Plan.